Good day! I am Craig Ian Amberlis, your student nurse from Nueva Ecija University of Science and Technology, and I am here to perform assessing thorax and lungs. Preparation, assemble equipment and supplies. First, the stethoscope. For efficiency, the nurse usually examine the posterior thorax first, then the anterior thorax. Second is provide for client's privacy. We need to close the curtain and ensure that we close the door. In women, drape the anterior thorax when it is not being examined. Determine client's history of the following. First is the family history of illness including the cancer, allergies, and tuberculosis, lifestyle habits such as smoking and occupational hazards, medication being taken, current problems like swelling, coughs, wheezing, and pain. Implementation, inspect the shape and symmetry of the thorax from posterior and lateral views. Compare the anteroposterior diameter to the transverse diameter. Ma'am, pwede po ba kayong tumayo? The symmetry and the shape of the thorax of the patient is okay, and it's normal. Inspect the spinal alignment for deformities. The spinal alignment of the patient is normal and it's okay. Ma'am, I'm going to palpate your posterior thorax. I'm going to start na po. In palpating the posterior thorax, for the clients who have no respiratory complaints, rapidly assess the temperature and integrity of all chest skin. For clients who have no respiratory complaints, palpate all thorax areas for bulges, tenderness, and abnormal movements. The posterior thorax of the client is normal. Palpate the posterior thorax for respiratory exercution or thoracic expansion. Place the palms of both of your hands over the lower thorax with your thumb adjacent to the spine and your fingers stretched laterally. And ask the client to take a deep breath while observe the movement of your hand and any lagging movement. Ma'am, inhale po. Exhale. Inhale. Exhale. Inhale. Exhale. The next procedure is palpate the thorax for vocal fremitus or tactile fremitus. The faintly perceptible vibration through the chest wall when the client speaks. Place our thumb near at the backbone like this. And ask the client repeat such word like blue moon. Ma'am, can you say blue moon repeatedly?
Blue moon, blue moon, blue moon, blue moon, blue moon.
Okay na po. Thank you po. And now, we're gonna percuss the thorax. Ask the client to bend the head and fold arms forward across the chest. Ma'am, can you slightly bend your head and across your arms over your chest? Thank you. And now, perform the percuss in the intercostal spaces in about 5 cm or 2 inches intervals in a systematic sequence. And now, we can auscultate the thorax using flat disc diaphragm of the stethoscope. Get your stethoscope. And now, we're gonna use the systematic zigzag procedures in percussion. Ask the client to take slow deep breaths through the mouth. Listen at each point to the breath sounds during a complete inspiration and expiration. Compare findings at each point with the corresponding point on the opposite side of the thorax. Ma'am, can you take slow deep breath using your mouth? And I'm going to give you a cue if you're gonna start to take deep breath. Go, ma'am. Thank you, ma'am. Document findings in the client's record form and checklist, supplemented by narrative notes when appropriate, and report deviation from expected or normal findings to the primary care provider. And that's it. That was my video on how to do assessing lungs and thorax. Again, I am Kriti and I'm your student nurse from Nueva Ecija University of Science and Technology. Good day.